The new COVID-19 variant is gaining momentum in our community, and I need your help. As you are likely aware, Texas is currently experiencing what Department of State Health Services, DHHS, has described as the third wave of COVID infections. These state health officials reported last week that the 7-day average of new cases is up 92% from the week before, a rise that is faster than either of the previous 2 waves of last summer and last winter. Hospitalizations have increased by 49% from the week before, with every age group seeing an increase. COVID-19 related deaths are up 15% from the same time period. DSHS reports that 75% of new Texas cases are due to the COVID-19 Delta variant. In addition to encouraging vaccinations to reduce the impacts of COVID-19, DSHS is encouraging those who are not fully vaccinated to wear a face covering. The facts are clear. Being vaccinated is the best way to help defend against this virus. Our community needs each other, and I need you to listen. There are medical professionals here today who will confirm this. Both of our hospitals, Christus Good Shepherd and Longview Regional Hospital, will give an overview of their current status. There are no new orders being given by the governor's office. There are no new orders by my office. As a community, each of us must take a personal responsibility to do what is in the best interest of ourselves, our families, and our community. Again, facts show that being vaccinated clearly helps prevent the spread and is effective in reducing the illness from the virus and its new variant. Today, our community is almost 40% vaccinated. We can and we must do better. Since the first opening of the vaccine hub, there has been numerous other sites available for vaccines. I think it's close to 40 now. If you have not been vaccinated, please consider it. In the meantime, please avoid crowds and consider wearing a mask if you are not fully vaccinated. This virus can be beat, but only working together will we defeat it. I thank you again for being here today. The community needs to work and partner with one another. We need the community's help if we're going to beat this. At this time, I'd like to introduce Todd Hancock, CEO of Longview Regional Hospital. Todd.
Thank you, Judge. Good afternoon. I'm the CEO of Good Shepherd Health System, and I do want to come to you today and kind of give you a status, as the Judge mentioned, of where things stand with your local hospitals. My counterpart with Longview Regional will approach the lectern in a few minutes, and we've had a chance to visit, and I think both hospitals are in a similar circumstance. First, let me tell you that we are seeing a new surge, and it is significant in the community. Some of you, this may be news to you because things tend to look sort of normal right now in our community. But this next crisis, Judge referred to it as the third wave. This third wave is really potentialing for being a crisis in healthcare. And the crisis, I'll explain in a minute why it's different now as to where we were. In January, mid-January of this past year, or this current year, we peaked at around 200 COVID patients a day in our hospitals at the Good Shepherd Health System. The significance of where we are now, we're at half that rate. The projection is that within possibly a few weeks, we will be approaching where we were in January. What is different? What is different is in January, the state was providing us with hundreds of nurses a day to take care of those patients. The state is not providing us with nurses at this time. The state is not providing us with funding at this time. So where are hospitals going to get the staffing that we need to take care of these patients? Well, we're going to the market to get these nurses. And it's not just nurses, it's other allied health professionals. You can imagine to take care of what would be really a separate cohort altogether when you're talking about hundreds of patients in our community. We need laboratory technicians, we need respiratory technicians, we need a whole cadre of healthcare professionals and doctors to take care of all of these patients, these COVID patients that are presenting, who are very sick. I'm going to focus on nurses because they sort of represent the point of the spear in caring for these patients at the bedside. So where are we going to get these nurses? We're paying exorbitant rates out in the community. The resource is extremely scarce. Many nurses are leaving their communities and going around the country to work because the financial opportunity is very lucrative. That's not only leaving us with a void in our present need, but we're trying to backfill our nurses who are doing the same thing in our communities. So we need help. First, the help comes in the form of this. And this is unprecedented for our organization. But I am reaching out to nurses that are viewing this program live today. If you're a nurse and you have a license in this state, or even if you have a license in another state, we want you to call us at 903-315-2000. And let's talk and see if you can volunteer, even for a short period of time. And by volunteer, I mean we will pay you. But we know that you may be doing other things. Your community needs you. So we are asking in an unprecedented way for nurses to step up and to call us and see if you can help us through this crisis. Additionally, as the judge mentioned, we ask the community, we beg the community, if you are not vaccinated, you need to get vaccinated. It's not just about your health and your family's health. This is about the health of the community. It's not just COVID patients that are trying to gain access to our hospitals. We have people that are in ERs all over the state that are waiting. Many of them are not attached to hospitals, but are freestanding ERs. And they are waiting sometimes for days to try to get a bed in one of our hospitals. There are no beds available in our hospital. This is going to get worse before it gets better. You can help in a way that you might not have ever thought you could help by being vaccinated. I promise you this, that the people that are in our hospital today that have COVID, that many of which are very sick, they did not think that they were going to get COVID. They thought they were healthy. They thought they were young. But they are very sick, and they are in our hospital. I'm going to ask Dr. John DePasquale, who's Chief of Emergency Medicine for our organization, to come. He is on the front line every day. He is taking care of these patients. And I want him to share his experience so that the community can understand that this is serious and we need their help. Dr. DePasquale?
Thank you. I wish we were all here under better circumstances and celebrating a triumph over this pandemic, but instead we're not. This is getting to become a crisis, and we are about to see our darkest hours. For over 18 months, we've been planning for this very moment, and we need your help. I saw the first case of COVID-19 on March 3rd of 2020 here in North Texas. It has continued to encompass the entire region and the entire country. We're overwhelmed in the emergency departments. Our clinical and non-clinical staff are exhausted, physically and mentally. May and June looked good for us. We had a little bit of a break. We had a breather. And now it's becoming demoralizing to us. What are we seeing? We're seeing a large number of COVID patients again, but the patients we're seeing are unvaccinated. It's nearly 100%. The patients are younger. I'm seeing patients in their 20s and 30s that for no reason are coming into our emergency department gasping for air. Just as Todd just said, you don't ever think this is going to happen to you until it does. We need your help, and this is what we need. If you are sick, even if you think that you just have a cold, or you think it's your seasonal allergies, assume the worst. It could be COVID-19. You become a vector, you become somebody that could transmit this to someone that does not survive. Every death that we've had in the world from COVID-19 came from someone else. It didn't just start within that person. Secondly, we need you to practice rigorous hygiene. We have to get back to where we were last year, wearing masks, socially distancing, washing our hands, avoiding people if you have any symptoms. If you are diagnosed with COVID-19, please adhere to your quarantine period. Lastly, the vaccine has become such a hot topic of debate. There has never been a vaccine in history that has been studied more than this vaccine, contrary to what you may see on social media from your friend of a friend. This vaccine is safe. The FDA would not have administered the EUA for this vaccine if it wasn't safe. It went through the same rigorous trials that all vaccines go through. Full approval by the FDA is imminent. It will happen. The vaccine will save lives. We are not caring for an inordinate amount of people who've been vaccinated and that they're now sick. So please, with tears in my eyes, cooperate with us, trust us. The people that are coming up here are your friends, they're your neighbors. We go and shop at the same stores, we eat at the same restaurants, we hang out at the same parks, the same ball fields, and we need you. We need you now, we need you to help us. I want to now introduce Steve Gordon, the CEO of Longview Regional Hospital.
Thank you, Dr. DePasquale. Good afternoon, everyone. This afternoon, I have the pleasure of being here with colleagues who have supported us from the beginning in the fight against COVID-19. Thank you to all the speakers who are advancing this message that so desperately needs to be shared with our community. I would also like to thank our elected officials, Longview EMS and Fire Department, local law enforcement, Gregg County Health Department, our colleagues at Christus, and the many community organizations who have continued the fight against COVID-19. As Todd mentioned, Longview Regional is seeing very similar pressures associated with this resurgence as described at Christus Good Shepherd. On July 4th, about 30 days ago, we had 8 positive patients in-house at our hospital. This morning, we had 47. Now, if you were to look at that census and pair out only the vaccinated patients, we would have a census of 1. The other 46 are unvaccinated in our hospital. Of those 47 in our hospital, 16 are most acute in our intensive care unit, many of which are on a ventilator to assist with breathing. Again, to look at that patient population that is vaccinated, we would have an ICU census of 0. The rise in the number of COVID cases and an increase in severity has had an impact on Longview Regional Medical Center and its capacity. We're evaluating and managing our needs and resources on an hourly basis to manage this growing demand. Our team of employees and physicians continue to rise to meet that need, and we are tremendously proud of them. They remain committed to providing the best care possible and demonstrate this in the way they care for our patients and their families. Our emergency room, while overwhelmed, is prepared to provide care for all patients who need medical attention, and patients experiencing a medical emergency are encouraged to seek care promptly. But I stand before you today not only as the CEO of Longview Regional, but also as a fellow member of this community. And I would say to all of you watching, you are needed in this community. You are counted on by your family, by your friends, by your coworkers, by your fellow members of this community. Your health and well-being is critically important to meeting those needs, and a major step that you can take in ensuring your continued health and well-being is vaccination for the COVID-19 virus. As you consider vaccination, I would encourage your source of information for weighing the benefits be someone who has trained and committed their life to medicine, health, and well-being, your doctor. Have that conversation soon, and let facts and expertise help guide your choice. With that, I'd like to introduce Dr. Glenn Genovese, pulmonologist and critical care physician at Longview Regional.
Thank you. There's not much more I can add to what has already been said here today. I mean, 47 people in the hospital, 1 vaccinated. In the last 3 months working in the ICU, I've taken care of 1 vaccinated patient. This year has been like I say, a nightmare that we had only thought happened in movies, science fiction, but we knew something like this could happen. We relied on the sensibility and the medical infrastructure to get everyone vaccinated. It's here, it's happening, and we're still not fully vaccinated. People will point out problems, concerns with the development of this vaccine. Well, let me tell you, there aren't any. When you look at the success rate, it's amazing. If we catch a Delta variant, despite being vaccinated, we can spread it to other people, but we won't be hospitalized if we get vaccinated. Like I said, at this point, I look at it, all of these hospitalizations are unnecessary. They are all preventable. Don't let this happen to your family or to you. Like I say, I don't have much more. Appreciate all the people who have come up here before me. Let me introduce the Mayor of Longview, Andy Mack.
Well, I think it's been clearly stated, and there's no reason to beat the dead horse, but our job as elected officials and as CEOs and as physicians and doctors and those that are taking care of you are to inform you, and that's what we're doing. We're giving you information for you to make an educated decision. Self-responsibility is what we're talking about today. The statistics / facts are very clear, but there will be those that don't believe those or will ignore those facts. And that's once again personal choice. But vaccination has proven to be effective. It's proven to be a way to counter this virus. It's proven to be a way to help prevent spread of the virus. So if you want to be vaccinated and you have not been vaccinated, it is very easy. It is free and it's available to anyone who wants it from 40 plus places in town. You can walk in and get it today. For those of you who choose not to be vaccinated, once again, that is your choice. But please be responsible in the choices that you make so that we do not infect others. If you feel sick, stay home. Don't go into public, don't go to work. Go get tested. If you get tested and you are positive, then maintain your quarantine period so that you don't involuntarily or carelessly infect somebody else. That's all we can ask of you, is just to be responsible. Our job is to inform you, and that's what has been done by these professionals that have been up here before me. And now it's our job as citizens of Longview and Gray County to do what we know is right, to help your citizens, your neighbors, your family, your friends, your coworkers. So to do that, it's just being respectful of their space and realize masks work. They've been proven to work. There are some that don't want to wear a mask, and once again, that's your choice. We're not going to force you to wear them, but realize that they work. Social distancing has worked. Washing your hands has worked. All the things that we have done have worked. If we'll all do this more and more, it will be easier for us to combat this vaccine, because if the hospitals become overrun with COVID patients, they'll be forced to shut things down sequentially, starting with elective procedures and things like that we don't want to see happen, because we all need to have our procedures done and do the things that hospitals are supposed to do, and that's provide care. We can't allow them to be overwhelmed by our neglect. So let's do what is right, do the right thing, and we'll get through this, Longview. Thank you all for being here. Thanks for those who have spoken today, and this will conclude the press conference.